Welcome. You are listening to IJD in Focus, the monthly podcast series of the International Journal of Dermatology, featuring the latest editors' highlights and a summary of our open access publications available to everyone.
Hidradenitis suppurativa, or HS, is a chronic inflammatory skin disease characterized by painful nodules, abscesses, and tunnels. Our July issue highlights key advances in understanding its pathogenesis and improving clinical care. New data suggests that the haptoglobin 2:2 genotype may be linked to familial HS and increased flare frequency, pointing toward potential applications in risk stratification. Another study explores the role of neutrophil extracellular traps, known as NETs, in HS, identifying their presence in both lesional and perilesional skin, and correlating serum NET markers with disease severity, findings that may inform future biomarker development. A comprehensive review addresses therapeutic strategies during pregnancy and lactation, evaluating the safety of topical, systemic, and biologic therapies to support individualized, safe treatment choices. Additionally, a complex surgical case illustrates the successful management of massive scrotal lymphedema in late-stage HS, emphasizing the value of integrated medical and surgical care. Together, these studies underscore the importance of personalized and multidisciplinary approaches in HS management.
In an open access original article, Abu Rached et al. Studied haptoglobin genotypes in HS. Haptoglobin, or HP, is an acute phase protein and an independent marker for HS severity. The different HP genotypes, HP11, HP12, and HP22, differ in their antioxidant and anti-inflammatory functions. HP genotypes have never been investigated in HS patients. The author's aim was to characterize and determine the frequency of HP genotypes in HS patients. Additionally, the characteristics of the different HP genotypes were analyzed for differences in personal, disease-specific, and laboratory parameters. Genomic DNA was extracted from peripheral blood leukocytes. Polymerase chain reaction products were separated and analyzed using 0.7% agarose gels for genotyping. The chi-square test, Kruskal-Wallis test, and/or post-hoc analysis with the Dunn-Bonferroni test were used to determine differences between the different genotypes and HS characteristics. The authors compared the genotype distribution in HS with 69 randomly selected, unmatched, and healthy control patients. A total of 72 patients with HS were included in the study, including 29 women and 43 men. A positive family history of HS was reported by 29.2% of patients. HP genotype 1-1 was present in 20.8%, HP1-2 in 33.3%, and HP2-2 in 100%, 45.8% of HS patients. The control group had a similar HP distribution with 18.8%, 37.7%, and 43.5% respectively. A positive family history of HS was significantly more frequent in HP 2-2, 42.4%, compared to HP 1-1, 6.7%, and HP 1-2, 25%. The number of HS flares in the last 4 weeks was significantly higher in HP 2-2 patients compared to HP 1-2 patients. HP genotype 2-2 and the HRP2 allele were significantly more associated with familial HS than the other genotypes. In addition, HS patients with genotype 2-2 had more frequent flare-ups than those with the different genotypes.
A second article by Van Dalen et al. Examined neutrophil extracellular traps in HS lesional and perilesional skin. Neutrophils are scarce in healthy skin but infiltrate lesions of HS patients. Activated neutrophils release pro-inflammatory neutrophil extracellular traps, also known as NETs, which have been implicated in the pathophysiology of HS. The study describes the distribution of NETs relative to the features of HS skin lesions, and reveal whether serum NET markers were elevated in association with disease activity. Immunohistochemistry assessed the distribution of the key NET component citrullonated histone, H3 or site H3 in lesional, perilesional, and unaffected HS skin. Several markers of NETs, such as nucleosomes, calprotectin, and CTH3, were quantified in HS serum with ELISA. HS lesional skin biopsies showed increased CTH3 positive staining compared to unaffected skin. This signal was widely distributed across both lesional and perilesional regions of HS skin and was associated with HS structures such as the lining of epithelialized skin tunnels. Moreover, several net-associated markers were elevated in the serum of HS patients compared to healthy volunteers and correlated with each other. Finally, serum net markers showed significant elevation in patients with moderate to severe disease activity based on IHS-4 scores, compared to those with no or mild activity. Elevated NET markers are widely distributed in HS skin and serum. These data indicate that net-associated markers in serum are candidate biomarkers for HS disease severity. The results confirm the rationale for anti-inflammatory therapy targeting NETs in HS.
The aforementioned review by Uzbek et al. Contributed to our limited knowledge regarding HS during pregnancy and lactation. Predominantly affecting young adults, particularly females, HS often emerges during reproductive age, and flares are widely reported during pregnancy and postpartum, underscoring the need to consider management strategies tailored to pregnant or lactating individuals. Moreover, the chronic and relapsing nature of HS, along with challenges related to the safety and compliance of medication use during pregnancy and lactation, as well as various comorbidities and psychological distress, significantly complicate its management in pregnant or lactating women. Treatment options, including topical clindamycin, oral clindamycin, rifampicin, adalimumab, metformin, antiseptic washes, and certolizumab pegol, have accumulated evidence supporting their relative safety in pregnant and lactating women. While certolizumab pegol has shown promising safety data among biologics, it requires more efficacy data in HS. Conversely, while newly approved HS medications such as secukinumab and bimekizumab show promise for the general population, further research is necessary to evaluate their safety profiles in pregnant and breastfeeding individuals.
Another noteworthy review by Ali and Al-Niemi endeavored to explain the pathogenesis of melasma. Given the prevalence of melasma, a thorough understanding of its pathogenesis is critical for the development of effective treatment strategies. The authors analyzed the current literature to identify findings related to epidermal changes, basement membrane alterations, and various dermal modifications, including solar elastosis, mast cell activity, and vascular changes. They also examined the influence of visible light and hormonal fluctuations on melasma. The review intertwines these insights with an overview of contemporary treatment approaches. The findings indicate advancements in understanding melasma's pathophysiology, highlighting significant changes in the epidermis and basement membrane, along with dermal factors such as vascular alterations, mast cell involvement, and senescent fibroblasts. A survey of the available treatments targeting these novel mechanisms revealed promising therapeutic modalities currently under investigation. Understanding the latest pathophysiological insights is crucial for enhancing clinician awareness and patient reassurance, as well as improving therapeutic strategies. Nevertheless, ongoing research remains essential to elucidate the complexities of melasma further and optimize clinical outcomes.
Also featured in the current issue is a Viewpoint article by Jeffrey Donovan that brought a fresh perspective on frontal fibrosing alopecia, or FFA. The author argues that FFA presents with a wide and complex range of signs and symptoms that extend far beyond the frontal hairline, supporting the argument that it should be reclassified as a syndrome. Recognizing FFA as a syndrome, rather than a single disease entity, would better reflect its diverse manifestations, improve diagnostic criteria, and promote more personalized treatment approaches. This shift in perspective could also foster more productive discussions among clinicians and researchers, especially given the current disagreements on optimal treatments like dutasteride and isotretinoin. Finally, renaming FFA to FFA syndrome may enhance patient-practitioner communication by validating the varied and individualized patient experiences.
This month's Clinicopathological Challenge by Regester et al. Presented the case of 5 males with progressive skin, thickening, and hoarse voices. The 5 male patients, including 4 siblings and 1 unrelated child, presented with progressive hoarseness, waxy eyelid papules, mucosal thickening, and skin plaques. Histopathologic analysis revealed PAS-positive perivascular hyaline deposition, and genetic testing confirmed a homozygous ECM1 mutation in all patients, consistent with lipoid proteinosis, or LP. This rare autosomal recessive genodermatosis highlights the importance of early dermatologic recognition of systemic disease. Multidisciplinary evaluation enabled timely diagnosis and informed management. This case emphasizes characteristic findings of LP and underscores the diagnostic value of skin and mucosal examination in rare inherited disorders.
This was the July episode of IJD in Focus. Thank you for listening. Until next time.